what got you started for this book? I mean, you developed an entire chapter around athletic issues. And we should probably start off, though, with defining what is disordered eating for the listeners who may not even know what that is.
Sure. Well, eating disorders take a variety of forms, but most eating disorders have an obvious component where there's disordered eating behaviors. Maybe someone's eating too much, maybe someone's eating too little. Maybe they fluctuate between those two extremes. Eating disorders also come with a familiar component of body image distortion, where someone sees their body in an inaccurate way. Especially with anorexia nervosa and bulimia nervosa, people tend to think that their bodies are larger than they really are and fear gaining weight. And so we see a lot of unhealthy diet behaviors, fasting, laxative abuse, purging, self-induced vomiting. And so depending on the kind of eating disorder a person is diagnosed with, you're going to see some or all of those behaviors.
You know, it's a very good point about the way that athletes don't perceive themselves realistically when they are suffering from something like this. And joining the show in a little bit is going to be someone who contributed to your book, Lynn Bjorklund, who was an elite long-distance runner. And I highlighted a comment of hers in your book related to that, where she says, I remember being at an international competition in Europe where 3 of the top women distance runners in the world discussed how fat and inadequate they felt, that they could perceive themselves as being fat.
Which seems like an amazing comment to us, because when we see distance runners in competition or even see them on TV, we see how thin they are. Naturally thin, but of course thinner because of how much athletic activity they participate in.
Right.
And I think that athletes can fall victim to losing touch with what is normal when it comes to how much food to consume, how much exercise they should be engaged in, and how slim their bodies should appear.
And that is a number one question, I think, of a lot of parents and athletes, because I get these questions in my practice as well. How much exercise is too much exercise? And that's actually question number 37 in your book. So I thought we would just sort of start with that. How much exercise is too much if you're an athlete? I mean, isn't it just normative to exercise every single day until you can't go anymore, and to offset the number of calories you've taken in and all this? How much is too much?
Well, it's interesting because in our society today, we really think about exercise in terms of weight loss or burning calories. But exercise is really not intended to be just a form of weight loss or calorie burning. It's really intended to be something that you take pleasure in, that you enjoy the feel of movement, you enjoy participating in whatever athletic activity that it is. When it turns into just a way of losing weight or just a way of compensating for calories you've consumed, then you might be running into problems down the road. It actually is a good idea to take time off of exercising, and sometimes athletes can be under the false assumption that you need to exercise every day. You need to keep exercising even if you're injured. You need to keep pushing yourself harder and harder, but the truth is that it's better for your body if you give your body a rest.
Yeah, we're up against a big wall on this one, and that is that all sports almost have become year-round because of camps and just, they've got clinics, and college coaches come out to see you at some big showcase thing. And so it's become year-round. And so are you seeing a rise in disordered eating with certain populations because they are performing year-round under so much scrutiny and pressure?
We are. We've seen a rise in eating disorders among athletes especially. If you think about the rate of eating disorders in the general population being slightly less than 10%, but with female athletes at the college level, the rate of eating disorders is more like 1/3. And then when you talk about certain elite sports, especially where performance is involved and appearance is important, like gymnastics and figure skating, as many as 62% of college athletes in those elite sports have eating disordered behavior.
Okay, wait. So 1/3 of all female collegiate athletes
have some sort of eating disordered behavior, yes.
And then in sports where image is of a higher importance because the body's on display as a part of the sport.
Exactly.
It goes up to 60%?
Yeah, just about 2/3.
Wow.
And the rate of eating disorders in the general population is slightly less than 10%. So you can see how some athletes are at much higher risk for eating disorders.
Okay. Now, another thing that, people ask me is, kind of, so what? So what if they go through this kind of restriction, or maybe it might be emotionally difficult for a little while? It's worth what they're getting out of the sport, and it paid for college, and so what?
Well, I'm glad you mentioned that, and I think that Lynn can speak to that as well from her experience. It'll be interesting to hear. But, many athletes think that if they push themselves really hard and they just pay the price for it, through fasting or through trying to make their weight class by even binging and taking in too much calories in a short period of time, that it's worth the effort. But really, in the long run, their athletic performance is going to suffer because the consequences are going to begin to show on their body, whether it's irregular heartbeat or intense fatigue or muscle strain or fractures because of osteoporosis due to too low of a body fat percentage, which, by the way, can happen not only in women but also in men, which some people don't realize. In the long run, it's going to hurt athletic performance if you don't watch disordered eating and instead fall victim to some of these patterns.
So maybe we should rename the female athlete triad to just the athlete triad?
Well, we are seeing more and more men at risk for osteoporosis because we're finding a higher rate of anorexia as time goes by. Now, granted, only about 10 to 15% of all people with anorexia are male. But at the same time, the fastest growing eating disorder population is among teenage boys. And so when we're finding more males involved in peak performance sports and elite sports where a lot of weight is being lost, they are actually at risk for osteoporosis, and people don't really associate that with males.
Yes, it's something that a lot of people are probably listening right now saying, I don't comprehend exactly what you're telling me right now. If you're just tuning in, you're listening to the Dr. Casey Show, and I am joined by my guest today, Dr. Sari Shepphird, and we're the author of 100 questions and answers around this issue of disordered eating. And you mentioned the female athlete triad. I want to review that in a little more specificity for everyone, because this is something that those of us working with athletes have been aware of for quite some time, but a lot of people and a lot of parents don't really know what this is. And so if you wouldn't mind reviewing the triad, and now from what I'm hearing from you, we're seeing this in males too, so we might need to think about renaming it.
Well, we're seeing at least two components of it in males, and it'll be obvious which one we don't see. But the female athlete triad is something that talks about three interrelated problems, especially among female athletes. The first is eating disorders. The second is osteoporosis, or bone loss, in other words. And the third is amenorrhea, where a female athlete will lose her period. So I think out of the three, we can guess which one doesn't pertain to males. But we see these things come together as a triad in female athletes.
But the critical component about the injuries that are difficult to recover from, and the long-term just recurrent injury, the nagging injury, that stress factor that won't go away, has a lot to do with bone loss that is correlated to body fat percentage.
That's
and
right.
A lot of people don't realize that with the young athletes. And so if you wouldn't mind sharing, what it is that they're missing out on.
Right. Well, a lot of female athletes tend to get their period late, especially if they start athletics when they're really young. And I know Lynn speaks in the book about how she didn't even have her first period until she was in her 20s, which is, a signal that there was something going on with her body. But when a woman has a time where she loses her period for at least 3 months, or if she doesn't get her period when it's expected to come around age 13, 14, then she's considered to have amenorrhea. And that actually increases the risk substantially of osteoporosis or of bone loss. So we have a higher risk for fractures. We have a higher risk for injuries taking longer time to heal. And it can even affect women's fertility. So the assumption that some athletes have that losing your period is normal because you're involved in intense sports and you burn a lot of calories and you really watch your body fat, it's really not normal to not have a period. So if there are athletes listening who haven't had a period in a while and are wondering if it's normal, it's a better idea to go see your doctor.
Because laying down that bone density early in life is what's going to sustain your bones and that density forever. And if you're missing out on that because you don't have the appropriate percentage of body fat, and your body's not going through regular cycles, it all contributes to becoming osteoporotic. And it's so shocking to think that a 16-year-old could be showing signs of osteoporosis.
It is shocking, and it's really sad. And it also cuts the careers of athletes short because they'll have more frequent injuries, and it'll take a longer time to heal if they don't have that body fat in order to protect their bones.
Absolutely. Let's go through some myths related to question number 40 in your book. And it relates directly to this. I thought lower body fat percentage makes you a better athlete, but now I know it's not true. What are some of the other misconceptions about weight and sports performance?